First at 4:30, 4 years ago this week, society began to shut down. On March 11, 2020, the World Health Organization declared the coronavirus to be a global pandemic.
Since then, more than 2,100 COVID-related deaths have been recorded here in Hawaii. State epidemiologist Dr. Sarah Campbell is joining us live to discuss where the state stands today. Doctor, thank you so much for joining us. Now, 4 years later, how many cases of COVID is the state still seeing on average?
We're certainly in a very different place than we were 4 years ago, but this isn't actually because COVID is spreading less. In fact, the science shows that COVID-19 is spreading faster as new variants continue to evolve. But as far as case numbers, Hawaii's daily average case count has come down over time from thousands of cases reported statewide each day during the peak of Omicron to numbers consistently less than 50 in recent weeks. But I would say that testing and people taking the type of tests that get reported to DOH has also gone way down. So tracking the absolute number of cases is not the best way to assess overall COVID risk anymore. Instead, we look at things like the percent of people who test that are positive and the numbers of people hospitalized with COVID-19.
And speaking of that, Dr. Campbell, how many patients are we seeing being hospitalized with COVID? Is the reaction to the disease still serious?
As of this week, there are an average of 30 patients currently hospitalized with COVID-19 on any given day in Hawaii hospitals. This number is lower than we've seen during recent surges in Hawaii. During the last statewide COVID-19 surge in August of 2023, the average number of patients hospitalized with COVID-19 was over 100.
Doctor, are new infections as severe as they were early on in the pandemic when everything was still developing?
Overall, we're seeing fewer people with severe disease than earlier in the pandemic. Even though we continue to see peaks in test positivity as high as 20% during surges, we're not seeing as many hospitalizations or deaths as we did with similar test positivity during the Delta or initial Omicron surges. Keep in mind that these are overall numbers across the entire population, so an individual person who gets COVID-19 today can still get very sick. We're seeing up to 7 deaths a week or a person dying each day from COVID-19 in Hawaii even now.
And doctor, how has the demand been for COVID boosters, and where does one even get a booster shot for COVID or a test these days?
First, I just want to clarify that the 2023-24 COVID-19 shot is actually not a booster. It's an updated version of the vaccine that's designed to target more recent variants. So everyone aged 6 months and up is recommended to receive the 2023-24 shot, and people 65 and older or who are immune compromised are now recommended to get a second dose to maintain higher levels of immunity. But to answer your question, the demand for the 2023-24 vaccines has been lower than we'd like to see. In Hawaii, just over 12% of residents have received the currently recommended shot. For adults 65 and over who are at risk of severe outcomes, that number is more in the 30 to 40% range, but we'd really like to see it a lot higher, more like influenza vaccine uptake, which is usually over 70% in our state.
Finally, doctor, it's remarkable. I mean, this is already 4 years now. What is your message to the public about COVID-19?
So I do want to say the effect that COVID-19 has had on our daily lives has evolved since the start of the pandemic, but so has our understanding of what works best to improve the health and well-being of our community in the context of COVID-19. So with that, the guidance is also evolving. CDC released new guidance on COVID-19 and other respiratory diseases just the other week. We are in the process of updating Hawaii guidance to align with those recommendations, but also to highlight key strategies to protect our community in Hawaii from COVID-19, as well as other respiratory viruses. So Hawaii guidance continues to emphasize staying up to date on shots, staying home when you're sick, and masking as valuable tools to reduce spread of COVID-19. Other strategies are covering your cough, washing hands frequently, taking steps for cleaner air, and testing and getting treatment if you're at higher risk of severe disease. It's also really important that workplaces continue to make it easy to do the right thing, for instance, by having flexible leave policies and encouraging people to stay home, really, if they are sick.
And stay safe out there. Dr. Campbell, thank you so much for your time and insight.
Thank you.